The multi-million-dollar investment in Luzira seeks to address a problem that affects an estimated 150 to 250,000 people in Uganda.
Goes unchecked, they die without being given an opportunity. We said this must change, particularly that in Africa, every 1,000 children out of 100,000 born, they will have that disease. Do we look at that and leave it to pass? We said no.
The unveiling, done at an event, started with a tour of the plant. And for the people living with sickle cell disease, this news means their survival is more defined, with access to vital drugs now made closer and easier.
I would like to see a future free of sickle cell, and I will do what I can on my part to ensure that it no longer exists. Because I dream of having children myself. I don't want to have my kids suffer this detrimental condition. I will encourage everyone to go for genotype testing because it is really important.
The plant will be producing hydroxyurea, sufficient for 1 million people living with sickle cell every year. While addressing the gathering, Dr. Diana Atwine says this move will reduce the dependency on foreign suppliers for the much-needed drug.
For the first time, Uganda will have domestically secured, reliable supply of hydroxyurea. I am so excited that the dependency curve, we are going down on the dependency curve on many of the commodities in our country. We will not have stock out, we will not have delayed shipment, we will not have foreign exchange shortfalls. We are in charge of the supply chain of our country. Countries, that it is high time a drug like hydroxyurea became part and parcel of essential medicines. It should. That one we have no option. It should. And for us, we are going to put it on the list of essential medicines.
She adds that the ministry will now embark on training more health workers to manage the blood disorder.
We have built capacity, we have trained people, and therefore now we are going to scale up the access to care so that people do not have to travel long distances.
While explaining the Uganda situation, Dr. Deogracius Munue, a pediatric hematology oncologist at Mulago Hospital, said Uganda ranks among the top 5 countries in Africa with the highest burden of sickle cell.
As I speak in Mulago, sickle cell disease is the #1 cause of admission in our emergency unit. And close to 2% of the population have the disease.
To reverse this, Dr. Atwine urged couples to conduct premarital gene type testing to eliminate the possibility of having children with sickle cell disease.
We need to scale up genotypic counseling, testing, especially for the people who are intending to get married, so that they do not produce the children with sickle cell. We are increasing the scale up of the newborn screening, and also we are opening our arms to welcome more partnerships, because we know that even when we are doing all these things, we can't do them alone. So we depend on.
According to existing data, the sickle cell gene is prevalent across Uganda at 13%, literally meaning 1 in every 10 people in Uganda carry the sickle cell gene. Walter Mwesije, NTV.